My name is Gail Finley. I'm the Vice President of Rural Health and Hospitals with the Colorado Hospital Association. One of my many jobs is to do some work in the workforce area, and I've actually done quite a bit of work in the nurse arena from a policy side. So I'm going to actually let each of the panelists introduce themselves, tell you what it is that they do with their organization. Glad they all could be here. They offer you a kind of a breadth of opportunities that we have in nursing and give you an idea what's happening with new grads and what you can expect in the workplace. Start with you.
My name is Allison Swyacker, and I'm the recruiter with HealthOne. And HealthOne has 7 hospitals here in Denver, including Spalding Rehab Hospital as well. So that's Swedish Medical Center, Skyridge, Medical Center of Aurora Rose, PSL, and North Suburban, and Rocky Mountain Hospital for Children. We have 4 new grad programs that we offer every year. The first is STAR-N, which is just our general new grad program that we offer for adults, med-surg, tele, critical care. That's offered several times a year, usually at least 4, but probably a little bit more, maybe for 2018, we'll see. And then we also have 3 residency programs that are more specialized. That's going to be our OR, so our perioperative services, labor and delivery, and then emergency room. So lots of different areas to explore. Critical care would be underneath the STAR-N program that we offer as well. So.
Hi, my name is Jill Fowler, and I am with Centura Health. I am in talent acquisition and have been working with Centura Health since 2009. So I've seen lots of changes in the recruitment and placement of new grad RNs. As Allison was mentioning, Centura as well has residency programs that are your best way to get into opportunities within our organization. Centura Health is 17 hospitals strong. 15 of those are throughout the state of Colorado, but the majority of our hospitals are within the Denver metro area. Littleton Adventist, Castle Rock, Parker Adventist Hospital, Porter Adventist Hospital, and then the St. Anthony's North and St. Anthony's Hospital are all under our umbrella. We do provide at least 2 times a year specialty RN residencies. These are 13-week programs. We provide them in perinatal, ED, ICU, and then we have our Peri-Op 101 program, which goes longer. It goes about 6 months. We will take new grad RNs for those positions. We will also obviously take new grad RNs for non-specialty areas. Hospitals train and orient new grad RNs a little bit differently depending on the hospital you're applying to. Some have formal residency programs for non-specialty, and others they're just making sure that you go through our Ascent program and that you have a strong preceptor and a little bit more in-depth orientating than an experienced RN.
Hi, my name is Laura Thomas. I'm the director of the APN PA Clinical Practice Department at Kaiser Permanente, Colorado. So I am specifically here to address APNs and PAs. Do we have any APNs? Yeah. 1. Okay. But just so you know, we do have our recruiters here who could talk to you a little about our statistics on hiring new grad RNs, which we are hiring into ambulatory care. Every month we get people that have not been able to find a job elsewhere, and ambulatory care is kind of the future of nursing, and our scope of practice as RNs allows us to do a lot of exciting things in the ambulatory care setting. But as far as APNs and PAs go, I think there were quite a few years that Kaiser had a reputation of placing a lot of students but not hiring a lot of new grads. And with the change in prescriptive authority and going from requiring a collaborative agreement to being able to practice independently and write prescriptions upon graduation, Kaiser last year hired 16 new grads, APNs and PAs, and we hired about 39 total APNs and PAs, and so when 16 of those are new grads, that says that the pendulum is swinging. We offer a 16-week new grad orientation And we hire new grads into specialties. We hired new grads into dermatology, orthopedics, general surgery, primary care, urgent care, and the ED. So Kaiser does staff APNs and PAs in the ED at St. Joe's and Good Sam, so there's opportunity there. And we work directly with new grads as far as the recruiting process, just because we allow you to apply for a position before you actually get your license, which is really nice. So you can't actually start the position until you're credentialed and have your license, but you get to apply, which is one step ahead of what you'd be otherwise. We just walk you through that process. We know that it does take Dora quite a while to get those licenses and prescriptive authority, and we don't want to wait, because it's even good for us to make sure that we are a step ahead, because then we can get you credentialed a little faster. So I have two colleagues with me today, Linda Kottman and Trish Arbuckle. They're part of my team, and we go out and we customize orientations for new grads, actually for all new hires, but we definitely customize orientations based on experience. Maybe you were a very experienced RN and you won't need the same orientation as someone who, kind of did the fast track. So the pendulum has swung. We're actually hiring new grads, so please spread the word to your colleagues out there.
Hi there, my name is Mandy Moore, and I'm the Nurse Residency Program Coordinator at University of Colorado Hospital. University of Colorado Hospital was really one of the pioneers to begin and create a nurse residency program for newly graduated nurses with their baccalaureate preparation. So we started that back in 2002 and have been going strong for the last 15 years. We are also the first in the nation to receive CCNE national accreditation for our nurse residency program. It's a 12-month program, so a year-long program in which you have the opportunity to seek out a position as a nurse. You're directly hired into a unit, and that covers the entire expansion of inpatient units, including critical care, ED, and we're also expanding into the ambulatory setting. With our last cohort, we expanded into the cancer center, as well as some of our procedural areas. So it's a pretty exciting time at our hospital. As you heard Will address you earlier this morning, we have now become a system, and so we do have a nurse residency program not only at Metro Denver, but as well as our North Campus and our South Campus. So that is something that we're really excited about. It's the exact same nurse residency program, and then it's our goal in 2019 to receive national accreditation for the nurse residency program as a system. So I'm excited to see all of you. I'm assuming many of you are new graduate nurses, and that is something that we welcome into our organization. It's a very supported program. Right now we onboard 4 times a year in February, May, July, and October. And each one of those cohorts, we hire anywhere from 50 to 70 new graduate nurses. So about 200 nurses a year of new graduates, and we take you through that year-long program. So there's several components to that, just to make you aware. Our goal is to develop you into a professional nurse. And so the components that help you with that is you need to learn how to be a nurse. And so you have a one-on-one precepted time on your unit, and that varies based off of whatever unit you're on. You have nurse residency program monthly seminars to support you. And then we also have the opportunity for you to do unit-specific classes so that you're very aware of what the needs are on that particular unit or department. And then you also learn about evidence-based practice and how you can make an actual change as a new graduate on a unit. So that is a full-on year-long program. At this point, you are very well supported because after we've been going for 15 years, almost 50% of our inpatient staff are graduates of the program. And in fact, myself as the coordinator, I went back through the program in its original in 2003, spent about 10 years in the ICU, and now I have the opportunity to coordinate the program itself. So we have recruiters here who can talk to you about more of the application nuts and bolts. I'm here to talk to you about the whole process, and would be happy to entertain any questions afterwards. But thank you very much for having us.
Hi, I'm Carolyn Walker. I'm the nurse educator for Centennial Peaks Hospital. We're an inpatient psychiatric facility halfway between Boulder and Denver. And we're located in Louisville, We have two sister facilities in Colorado, Cedar Springs, which is in Colorado Springs, and Highlands Behavioral, which is not far from IKEA. I'm not from Colorado, so I don't know where everything is quite. We also have 200 and some hospitals in our system nationwide in the Virgin Islands, Puerto Rico, and Great Britain. So this week I helped facilitate a couple of transfers out of state for some of our nurses that are relocating, one to California and one to Georgia, I think. So we have lots of opportunities to allow people to stay in the same hospital system and go to a med-surg hospital in another state or to another psychiatric hospital. We have an onboarding process. We start new grads. We like to see people come through our preceptor program, our capstone program, as nursing students if they have a high interest in working in behavioral health. And that's a 6-week structured program during their last semester of school. A lot of those students then stay on to become nurses after graduation with us. For our new nurses, we love new nurses. We hire new nurses. We don't eat our young. We have a very supportive staff. All the new nurses are matched up with the preceptor. Our onboarding process allows the new nurse to meet with their manager on a scheduled basis. They meet with me on a scheduled basis, and we look to see what you need to know. One person may be better and catch on faster with one aspect of patient care. Someone else may need more help with that area. So we try to individualize the program to fit the individual nurse because there's nothing like trying to be a square peg going into a round hole. I have some handouts if anybody wants some afterwards, if I've got enough, on 101 things that we should teach every new nurse that came from one of the ANA websites. That's got some helpful little guidelines for entering into your nursing career. We provide all of our new nurses with written materials that they can use so that they don't have to feel like, I know when I was a new nurse, I always felt badly asking, well, what do you mean when you use this term? Because people would look at you like, well, what do you mean you don't know that? So we try to provide enough material so that new nurses have the confidence to know what they know and also to know what they don't know. I'm happy to talk with anybody afterwards, but congratulations. Is everybody here a new nurse? New grad? It's exciting, isn't it? Everybody looking forward to taking their state boards? Do not fear if you get all 275 questions. We're always telling our new grads. I think that's how many you can possibly get, because some of you are going to be chosen to be the validation people for the next NCLEX. And that's something that's always really upsetting, I found, for new grads, is about 1 in 10 people come in and they go, oh my God, I got all the questions. Doesn't mean that you did badly. It means that you may be in that group where they're testing the last 50 questions to see if they work for the next group of NCLEX students. So just hang in there. It'll work. You'll pass.
There was a little orientation to each of their programs. As you can see, they're all a little bit different. I think they all started talking about residency programs, but I think that to get into the residency programs, you actually need to get hired. Is that the case? So in essence, perhaps someone could talk a little bit about what you'd expect to see in an interview with a new nurse. What would you expect to hear, or how could they best, present themselves, or what should they try to make sure you hear about them that might be useful? Get an idea of what are they looking for when they're looking at hiring a new grad. It's not just that you finished school and you passed a test. Okay?
Right. So I think that we all are probably looking for something a little bit different, but HealthOne, we're really looking for an eager new grad that is ready to get started and wants to be in the hospital setting. Sometimes, I talk to new grads and they don't know exactly where they want to start. They liked all their clinicals. That's fine as well. I think that a lot of times when I talk to new grads, I talk about culture fit, and we want to make sure that wherever you start off is a great environment for you, and is going to afford you opportunities to do well, and it's going to be a good environment to start. As far as resumes and things like that, just a very clear and deliberate resume that has what you're wanting and your licensure so far, even if you are waiting on your testing date. Those bits of information are always helpful. If you've got your NCLEX date, put that on there. If you've passed it, put it on there. Just every little bit of information helps. And then as far as meeting with managers, we do a lot of behavioral interviewing questions. So they're going to ask you, tell me about a time when you had a miscommunication with your colleague. What happened? Or, tell me about a time when you advocated for your patient. And we're looking for specific examples for you to be able to say, well, I did this in my clinicals, and here's what I learned, and those types of things. So really just overall positive attitude, eagerness, and readiness to get started.
Although we're different, I think that our processes are probably very, very similar. And I don't want us to all repeat. So I'll just add on to what Allison started. So we do hire for the residency programs. The titles as they're posted will say RN resident, and it will say if it's a specialty, if it's an ICU or ED, or it'll say new grad resident, because some of our hospitals do hire into non-specialty for a resident program. You do want to apply, and you do get interviewed for a position. You go through everything just as if it were a permanent position, because it is. And then you go into the residency program. Once you're completed, you go back to that hospital and you work on that unit in that position that you initially applied for. As far as the process, on that resume, we want to see where you did your capstone, where you did all of your clinical rotations. And when I mean where is which hospitals, because that's helpful for us to follow up on. If you have reference information from individuals that precepted you during your clinical rotations, that's valuable information. If you don't have your NCLEX yet, but you are applying, again, like Allison had said, make sure in a cover letter or you've got some sort of notation when that NCLEX date is, or when you intend to take that NCLEX, so that we can know that timeline, so that we can kind of work with it and see if it will work with the start of a program. Because as mentioned previously, we can't have you start if you haven't passed. Let's see. We again also do behavioral interview questions. We have an assessment. I assume you might. We have an assessment. So once you apply electronically, you would be sent an email notification to do an assessment. The assessment is 35 minutes long. It's not a competency-based one. They're looking for reliability, drive for success, so more of like employment characteristics. And then after the assessment, we would have a recruiter reach out to you to do a phone screen. This is your first trial for behavioral interview questions. So be prepared that they're going to ask you the brass tacks. They're going to ask about your past experience and what you're looking for schedule-wise and pay rate-wise and all that good stuff. But they're also going to give you a few behavioral interview questions. And this is your opportunity to really kind of exercise that skill, because that's what the next step is going to be in a face-to-face interview, is more behavioral interview questions. So you really want to have those examples well identified. You want to work on those examples and you want to practice, because a simple one that we'll do in a screen is, tell me of a time that you went above and beyond to provide excellent patient care, and handing someone a blanket because they're cold is not going to cut it. So it's good to have a few examples and maybe practice with a family member or a friend or something to really know which one shows who you are best and aligns with our core values and is the best representation of your past work experience.
I'll continue to add on to that. The behavioral-based question sounds like that's a common theme. I think the reason why we've moved towards behavioral-based questions is because, especially, and I'm sure it's this way everywhere, but one way I explain it is Kaiser is a culture of its own, and not everyone will fit into the Kaiser culture. So we try very hard to find candidates who we feel will fit into the Kaiser culture. It's a large organization. It's a slow-moving wheel. It's a bureaucracy. If you want to come in and you don't like something, you can't make it change tomorrow. And if that's going to drive you crazy and make you dissatisfied in your job, we want to identify that in the beginning so that we want people to come and be satisfied. One of the questions I ask in our what we call administrative interview, it's the very first interview you have. Some organizations call it a cultural fit interview or organizational fit. I like to know what are your top 3 expectations in order to be satisfied in this job. I think that tells a lot about somebody. Sometimes the number one thing is work-life balance, and that's okay if that's what's important to you. I like to hear honest answers. Also, I think a new pattern we're seeing is that people have a choice in where they go for healthcare, our patients do. So we all know that if you pass your certification exams, the NCLEX, you've done well, you have good references, you probably are going to give good patient care. But are you going to give kind of that, I know HCA or HealthOne uses extraordinary patient care, or where you go above and beyond. So we really look for people who they will go above and beyond, and that other than giving good evidence-based care, they're also can give us examples of how they go one step further, because we're all of our organizations are going to give you an opportunity to give good evidence, good high quality care, but it's we need to find those people that will bring our members and our patients back to us and choose each of our organizations. So we want those candidates that are friendly, that bond with their patients, that create good rapport. So we look for that, in the interview process. So don't come off too serious, and make sure that we get to know you as a person, because that's what we're going to expect you to give our members.
At University of Colorado Hospital, we do it just a little bit differently, so I think I'll explain our application process. There are some similarities, but a couple of differences that I just want to point out so that you're aware. We hire directly onto the unit, and any new graduate nurse that comes into our organization is automatically a part of the nurse residency program. So as they discussed earlier, the process is very similar in that I want all of you to know that you will most likely apply and begin the process before you graduate. If you've already graduated, don't worry, that's still okay too, but I just want you to be a little bit forward thinking. So most of you will seek out a whole, and I would tell you to cast your nets wide, seek out a lot of different organizations. Try to keep them straight though, that sometimes is very difficult. But cast that net wide and then look at that application and eligibility criteria. For us, we would like for you to start that process while you're still in school, and then we will hire you on the contingency that you will pass your NCLEX and have a license in the state of Colorado. But you can do all of that process, apply online, complete the supplemental application questions. What we ask you to do that's a little bit differently than my peers up here is that we put unit descriptors on our website, and a majority of our units hire new graduate nurses, so I would venture to say all of them will hire in the upcoming next cohorts. And we want you to identify your top 2 areas of interest, because then it allows all of our unit nurse managers as well as our clinical nurse educators to evaluate every single one of your applications, and every application is reviewed by that unit. And so they will look at your application, and if they find interest in you, they will then invite you for an interview. And I feel like that's a really important piece, because I want you to pick a unit that you are passionate about, that you care about, so that we can find the right fit the first time. If you find that, you will have a tendency to excel and enjoy and go very far in your careers when you have that really solid first start. And so we try to make that alignment from the get-go. So we ask you to pick your top 2 choices, and then if you're offered an interview, you will come in and you will actually interview with that unit. And then after our first kind of major week of orientation, you are literally on that unit that you have been hired to. And then it's just one piece of that big picture of the nurse residency program. So I think that's a little bit different based off of all of our different programs. We all do behavioral interviewing. That's kind of standard these days. So I think the advice of practicing is great. Sometimes you can have a really stellar answer in your head, and then it comes out as blah, 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 blah. So really, I mean, take that time to sit with someone or a peer or colleague and practice those so you feel comfortable in what you're saying. And really, I think it's no different from any of us. That unit is looking for a good fit in you, and you're looking for a good fit in us. And so feel free to have a list of questions that you might want to ask us as well. I would say do your homework, though, a little bit. Be knowledgeable about the organizations that you're interviewing with so that you can really get a little bit deeper into that interview. They're not meant to be intimidating, although they seem as such, right? But I think that if you go in confident and you're aware of that organization and you really just try to give us a glimpse of who you are, that would be my best advice to you. We are looking for well-rounded applicants who can handle the changing world of healthcare, right? It is a constant changing and dynamic environment. And so it's a great opportunity for us to get to know you a little bit better in that interview. So please feel comfortable in really sharing about yourself. Nurses are not very good about kind of speaking about themselves, right? That's often hard for many of us. And this is a time where I would really encourage you to let us know about you. Maybe experiences that you've had in the past, or how you want to address patient care, or different thoughts or ideas that you have that you can intertwine into some of these questions so that our units can have a better idea of who you are and see if that's a good match for our culture. But I would tell you my other words of wisdom, if I may do so, is take your NCLEX right away, you guys, please. If you hesitate and then the ATT to test and it takes a while and then you can't find somewhere to take your test, please don't go through that, because most of our programs require that you do have your license before you begin the actual program. And so what you do is you cause a lot of stress for us, and you cause a lot of stress for you guys because we're waiting for you to get that license before you begin. So I think my biggest advice is you all received a really great education, okay? So have the confidence and take the NCLEX as soon as possible to make for a nice transition so that you can enjoy and look forward to that very first job opportunity.
Okay, so our process is a bit different. We do the behavioral questions during a sit-down interview with the director of nursing, the managers of the various nursing units, and sometimes the lady that does the scheduling, because we want to make sure that everybody is comfortable with the fit. We take the applications from online or an in-person application. You can do a hard copy. We have done Skype interviews with people at a distance. We don't want to stress anybody out too much because it's already stressful enough to go hunting for a job. Since we're a small hospital, that model works a little bit better for us because we have 200 employees, which includes social workers. We're expanding, but right now I think we've got around 200 to 220 employees, which includes social workers, our mental health workers, our nurses, our intake department, our business office. So we have the luxury of being able to sit down with people and explore, what do you want to do? What do you want to get out of this job? Where do you see yourself in 2 years? Where do you see yourself in 5 years? So our process is similar but a little bit different in that we don't do pre-interviews. If somebody fills out an application, we pretty much think that everybody deserves at least to have a sit-down and a conversation to see, is this a good fit before we go any further. So that's how our process works. Then once somebody's hired, then we do the individual skills. What do you need to know? What do you need to be successful? How can we best work together so that we're successful with our patients and you're successful transitioning into that new nurse position? We do have some folks that start working for us before they're in NCLEX. They'll start working, let's say, maybe in a mental health worker position, and then once they finish school or finish their NCLEX, then they transition back into the RN position. So we do have some opportunities there for people that haven't gotten to the point where they're ready to take the NCLEX yet.